Good morning. I have the great privilege this morning of speaking with Fiona Dalton, the President and CEO of Providence Healthcare, one of the key healthcare providers for the province of British Columbia. Fiona and I have worked together for some 3 years now as a client on the sale of the Burrard Building, the old St. Paul's Hospital, and now we're moving on to the new St. Paul's Hospital at the Jim Pattison Medical Center. The hospital is now under construction. We're going to have just under a 2 million square foot hospital, and a big part of that is another 1 million square feet of ancillary buildings, the most important of which is the new Clinical Support and Research Center at St. Paul's Hospital. So we're here today to talk to Fiona about that hospital and talk to her about her vision for the new Clinical Support Research Center and how she sees that being an integral part of our community going forward.
My name's Fiona. It's my privilege to be President and CEO of Providence Healthcare. I've been here for just over 3 years now, and since then there's been a lot of change. We have, as Tony said, we've sold the Burrard Street site. We've started construction at Station Street for the new St. Paul's Hospital. It's a $2 billion programme, and we'll create an amazing acute hospital and ambulatory care centre. But we also have the remaining land on that site, and the vision is for much more than a hospital. It is for a whole campus of care in terms of healthcare, research, education, and innovation. And the CSRC is a really important part of that vision.
So maybe talk a little bit about that vision for that center and what you think it'll bring and how it will integrate and synergize with the hospital and the whole development overall, and why it's such an important piece.
Sure. So our vision is that the CSRC will be the place for discovery and learning, where talented people are focused on delivering excellence in patient care, research and innovation. And it will be the health innovation hub, where patients, physicians, researchers and leaders will be brought together with industry and academic partners all under one roof to create synergies, spark ideas, collaborate, solve problems. And it will be a hub that integrates research, technology, design thinking and partnerships with the private sector, academia and others to create the sustainable solutions that we all need to the challenges that face health and well-being across the world. Really crucially, it will be very closely connected with the acute hospital, physically via the public plaza and sky bridges, organisationally through all the patients, physicians and researchers who will move between the two buildings. So it will be a truly symbiotic health ecosystem. And it will include everything that the best and the most innovative organisations would want, from core research facilities such as wet labs and biobanks, access to patient populations for clinical trials, retail, end-of-trip facilities, and all centred around an innovation centre, a shared space with formal and informal meeting rooms, food and drink offerings, incubation space. So it can be a building that's more than the sum of its parts, an environment that encourages people to get out of their offices and their laboratories, to interact with the other tenants, to discover, to create and innovate. And we think that this building can be a game changer for Vancouver and for Canada. It's a truly unique opportunity to create an environment where clever people from the public and the private sector can collaborate and innovate just steps away from a brand new hospital filled with patients. And together, I think we can create a state-of-the-art facility that matches our people's talents, that facilitates medical breakthroughs and attracts even more top talent from around the world to Vancouver. Because I think it will be a real vibrant training ground. So it will be preparing a new generation of innovative scientists and entrepreneurs. And that phrase I heard the other day, talent is the new oil. I think this will be the kind of place where the best people want to be and where they're enabled to be their best. And together we can drive research, innovation and economic development in an unprecedented way to improve the lives of people across the world. This all sounds kind of crazily ambitious, but St. Paul's Hospital has a long and distinguished history of research and innovation. And we've been pioneers in many areas: HIV/AIDS, the opioid crises, the TAVI heart valve, chronic lung disease, just to name just a few. But innovations in these fields that were developed at St. Paul's have become the global standard of care and have saved lives across the world. And all of that was achieved in a building that was more than 100 years old. and it's a testament to their talents and passion and determination of the team. But if we can do that in this current building, what can we do in a brand new purpose-designed building? I believe we can keep changing the world.
Well, that kind of undermines my next question a little bit, because that's very important, changing the world. Since we've been on this file with you and worked with you, we've seen an amazing growth from the real estate investment world in life sciences and technology. It was only a short year ago when we first looked at this project and thought, well, this is a pretty ambitious project and it's going to take a lot of investors, and there didn't seem to be that many. And we were wondering about, looking for a needle in a haystack. I can tell you, in just the short year of you working on it, the interest in this field has grown exponentially. There is life sciences and biotechnology is almost the darling of the real estate investment world, but not only in the sciences, but also in jobs and for the city and for community in terms of creating a new industry. So many people benefit from this. So in the overall scheme of things, in addition to the developments that we can do in life science, why is this centre important?
Well, I think for Providence, everything starts with a patient, and the CSRC is really important for the patients that we serve. So having medical offices in the CSRC will allow us to extend the continuum of care on our campus. So there'll be acute care in the hospital, outpatient care in our clinics, follow-up visits to a specialist office in the CSRC. So same patient, same physician, same campus, but the right care in the right place for better use of our system's acute care space. But we also think about patients, not just the patients that we serve here in Vancouver, but patients and people around the world. And that you mentioned the COVID pandemic, and it has shown us all, hasn't it, that without health we have nothing. But also we've seen in real time how research and innovation can make all the difference. And so we believe that the new Station Street campus will enable us to take the special combination that we have already of patient care and research, and also allow us to invite new partners to join us in a world-class research and innovation hub. So we'll have state-of-the-art wet labs, dry labs, huge biobanks, clinical trial facilities, research centres of excellence, our research institute. But for those new partners, new tenants, from industry, academia, startups, more established organisations, we can, I believe, do more and foster new synergies between researchers and medical professionals with the biotech, pharmaceutical, digital health spaces. So that's on the health side, but I think that the CSRC is also a game changer for Vancouver in that hospitals are economic drivers, but so are biotech and digital industries. And the CSRC will be an R&D and innovation economic accelerator, attracting strategic industry partners, not just at our campus, but also the surrounding False Creek Flats area. And the City of Vancouver and the provincial government have both identified the False Creek Flats as the epicentre of Vancouver's health innovation ecosystem. Alan Winter, BC's Innovation Commissioner, specifically called out the opportunity for Station Street to form BC's first innovation precinct for health research and development. So I think for a developer, the CSRC is a truly one-off opportunity to position themselves at the heart of this new neighbourhood.
As I mentioned, we're seeing growing interest in this field of life sciences and biotech from all sectors of the real estate community and the tenant community. And so we think there will be lots of people at the table wanting to be your partner. When you take that into consideration and look back at partnerships, in your view, if you could tell those that want to be your partner, that want to invest with us here, what makes them a good partner, and what would you expect them to contribute to make this project a success?
So obviously the partner has to have the right experience and capacity to deliver the project successfully. The overall campus is the largest hospital redevelopment in BC's history, and we need to be confident that the project will be delivered on time, on budget, with great quality. But above and beyond that, it's also really important to us that we are able to form a strategic and strong partnership with the developer, and the developer wants to do that with us. We're looking for someone who shares our vision and our excitement about what this project could mean, who sees this development as a chance to create something that will be admired around the world and that will put Vancouver on the world map for health innovation. So we're looking for a long-term and close partnership with the developer where we both seek the same goals, to create a building where every tenant adds to the ecosystem and together we're greater than the sum of our parts. We think the tenant selection will be crucial, and we envisage a relationship in which we work collaboratively to curate the building with the right mix of strategically targeted tenants. And we're confident that if we get this right, every innovative and forward-thinking organisation in Vancouver will be competing to get space in this building. And I think, again, reflecting on COVID, and it's hard to not keep coming back to it, isn't it, after the last year, we've seen how much work can actually be done at home. And I think there's less and less reason to leave your home. So in the future, people won't be forced to leave home to go to another building. They'll have to want to go. And so I think the CSRC is an opportunity for a developer to create exactly this kind of building, the place where we want to go and work because of the facilities, the location, the other people there, and for us to show the world how this can be done. So we're looking for a partner developer who not only understands Providence's values and vision, but who also embodies them. And we're looking for a developer who wants to be part of taking the legacy of St. Paul's forward and creating a new legacy for the next 100 years.
Wow. Well, what a great fit for today's economy and today's environment, with the focus of investors on ESG and now life sciences, which has been brought home by, again, the pandemic. And what a great vision that the church had, the sisters had, to buy this site, 20 years ago. And here we are at a key time to develop this. So thank you very much for sharing that vision. I can assure you that there is great interest from the tenant community, and we've been reporting to your team along the way, great interest from the investment community, and we look forward to helping form that partnership, and looking forward to a great development that's going to make a difference and help change the world. So thank you very much for your time.
Thank you so much.